Gone. Oh, but that's going. Okay. Hello, everyone. I'm going to be talking about complications of pregnancy. And when we first start about talking about complications, we're going to start in the very beginning, and that would be our hemorrhagic conditions or bleeding. Are almost always referred to as some type of abortion. And you can see there are many. You can also add to the end here septic. I always forget to put that in, but there is a septic abortion also. So let's look at these individually. And also, I want to caution you in using your um, terms when you're talking to patients. In this arena with any of these, they were pregnant. So most people think of abortion as a therapeutic abortion where you're going in and ending a pregnancy. A lot of these people do not want it ended. So I would use the word miscarriage. But for our purposes, we're going to be talking about what is a spontaneous abortion and or a miscarriage. And spontaneous just means that they just spontaneously abort. Nobody knows why. If you put 100 pregnant women in a room, statistically 20 of those women will miscarry. And I'm saying if they're all due about the same time. So that's a high percentage. And those are the ones we know about. A lot of these we don't know. When people miscarry, they have a very heavy period. They may be 1 or 2 weeks late or even 3. And nobody knew. So, but the ones we do know about are still plentiful. Okay, so threatened abortion is just what that means. It's threatened. There's spotting to moderate bleeding, but the cervical opening is closed. And it can be with or without cramps, but no tissue is passed, and that's why it's called threatened. Inevitable is just what it says. It's going to happen. It's inevitable. Moderate cramps, they have mild to severe bleeding. Where threatened abortion, it was just, for the most part, it was more spotting than bleeding. No tissue is passed, though, in inevitable abortion. The cervix can be dilated with membranes or tissues bulging at the cervix. So the key here is that the cervix is dilated, and that's why it's inevitable. An incomplete abortion, we can have severe cramps, continuous and severe bleeding. Partial fetal tissue or placenta can come out. Its cervix is dilated with tissue in the cervical canal or the passage of tissue. So incomplete just means that we don't know if everything's out, but they're definitely aborted. A complete abortion is, this is a little one that's hard to understand. This is the one where when people think they have a heavy period, because it can be minimal bleeding and the cervix is closed, though, with a complete abortion, believe it or not. And there's no tissue in the cervical canal. That's the definition of it. And then a missed abortion is the one that's a little scary for hemorrhage and possibly DIC. It's a brownish discharge and prolonged retention of tissue. And sometimes when you see brown tissue, we know that's old blood. So this could have gone on for a while. And the cervix is closed. So for all we know, it opened and then closed. We just don't know with this one. But they do have prolonged retention of tissue, which we're going to talk a little bit more about. And then recurrent spontaneous abortion are the poor people, spontaneous up here, they just recur, is that they are just continually miscarrying. They're just not carrying the baby. They're having a really hard time doing that. And then the septic one is the one I wanted you to add. And that's the one with cramping. And they just have a malodorous discharge or a very foul smelling discharge. Tissue pass varies. The cervical opening is usually dilated. And that's one of the reasons, not just that they're retaining tissue, but that they are infected in their septic. So in looking at nursing interventions for threatened abortion, of course, they're going to tell you to go on bed rest and no intercourse. But I remember a doctor, I had miscarried my 3rd child, and he said, Judy, I can tell you to go and lay down and go on bed rest, but if the cervix is open, it's open. He said, you can stand on your head. The baby's still going to come out. I mean, basically, that's what he said. But we're going to count and weigh all pads to assess the amount of bleeding, save all clots, because for all we know, that's fetal tissue in there. IV fluids, we're going to have an oxygen ready just in case the person goes into shock. They have a steady, thready pulse. There may be tachycardic and a drop in blood pressure. We always know those are hallmark signs of shock. Assess for fetal heart downs, depending on how far along the baby is, have oxygen ready, possible blood transfusion. So definitely have had to draw an H&H and the blood type. And assess coping and give emotional support. For all we know, that they really, really tried hard for this baby, and it's very, very upsetting, especially even with the hormone shift, with what's going on. Extremely crazy. I forgot to mention, look for all the pictures in the PowerPoints I left up for you. That's the one I usually lecture to, and it's very hard to transfer over to video. It's hard for the computer. So I'm going to give you the lecture according to your PowerPoint, but without pictures. So you can kind of see in the picture over here, threatened abortion is bleeding with cramping. They can have a backache. A lot of times we know that labor can start in the back and proceed to the front. Pelvic pressure is definitely a higher rate for inevitable. Remember, this is just threatened. It hasn't happened yet. Inevitable abortion, again, with the picture, you can kind of see the membranes, and the cervix is dilated. So the membranes rupture and the cervix dilates for inevitable. Incomplete abortion is basically some products of the conception have been expelled, but some remain. And what happens when the products of conception remain in the uterus? That's what the POC means, products of conception. What happens? Well, we know what happens when the placenta stays in after the baby is born. It's the same thing. We can have infection and we can have hemorrhage. So this one can be very, very dangerous. Complete abortion, all products of conception are expelled. And sometimes they have to go in, though, if they don't know this, if they didn't witness it, or if the person doesn't bring in the tissue that was expelled, they have to go in and dilate the cervix and then scrape it out. And that's called a D&C, or a dilation and curettage. A missed abortion. What are signs of a missed abortion? This is the one with the brownish discharge, probably represents old blood. The cervix is closed, but with no cramps. So they have prolonged retention of tissue, and that's the theory behind this. And this, again, can lead to infection and prolonged retention of tissues. And here it is, missed abortion, infection, and with hemorrhage, we can always have DIC. I know you remember a little bit about DIC because we went over it in Patho. And it's basically a definition, my favorite definition of it is, whenever there's a bleed in the body will compensate with clotting. That makes sense. It's compensating to try to stop the bleed. But the problem with this little entity that happens, anytime the body compensates with clotting, it can potentially overcompensate. And basically, in this population, I wanted you to know that a coagulopathy in which clotting and anti-clotting mechanisms will occur at the same time with DIC. So I'm going to say that again. With DIC, a coagulopathy, which means pathology of the coagulation system, in which clotting and anti-clotting mechanisms occur at the same time. And so that's a big problem. Coagulopathies separate from DIC are suspected in this population when the usual measures to stimulate uterine contractions fail to stop vaginal bleeding. Because we know if the uterus is contracting down, it should stop the bleeding. And if that doesn't happen with all of the oxytocics that we have, they start to think that possibly this person has a clotting issue or a coagulopathy. So basically, with our clotting, with our DIC, we have extensive clotting consumes and destroys a substantial amount of the clotting factors, including platelets, fibrinogen, prothrombin, and factors 5 and factor 7. This exhaustive depletion of the clotting factors results in widespread external or internal bleeding, because basically they're wiping the clotting factors out, which in turn brings about the formation of small clots in the microcirculation, triggering vascular occlusion of small vessels with resultant vital organ ischemia. because we've got all these tiny blood clots floating around, and it's clogging up the system of our freeway of the blood moving. And so we have organ ischemia. We, in the beginning, we have a fibrinolysis, which occurs, which is the breakdown of fibrin, and that's a clotting factor. It increases, and then it diminishes with the degradation of fibrin, leading to accumulated fibrin split products. And whenever we find fibrin split products in the blood, we are looking at a condition of DIC. Having anticoagulant properties which prolong the bleeding time. Let's see, DIC can result in hemorrhage, renal failure. And why renal failure? It's because the kidneys are, filtering blood every minute, several minutes and seconds continually in our body. And so we've got a lot of blood being sent that way, but all of this blood has a bunch of tiny clots in it, which is going to clog up the kidney and cause kidney failure. And basically major organ failure throughout the body, and basically in most of the blood-filled organs first. And we know the blood-filled organs are the kidney, the heart, the lung, and the liver. So it's not a good condition to be in. And then here's my little cartoons where you can see we've triggered an event, which is bleeding in this case, our bleeding from we started to look at miscarriage. We've got local coagulation. That's what we want to happen, and then recover. But if that doesn't happen, it can go into coagulation and fibrinolysis, lose control, and the breakdown of fibrin. And the result is widespread clotting with resultant bleeding. Generalized intravascular coagulation, which is where we have all the tiny clots, using up more clotting factors, more bleeding. It's just exhausting. We've got more bleeding happening. Fibrin split products are being released, which are fragments of protein released from a dissolved clot. And that's what lets us know that, yes, DIC is probably happening, because why do we have a zillion clots in this person? Abnormal breakdown of fibrinogen, large amount can be used, fibrins deposited along the vessel walls, and then we have all these tiny thrombosis in small vessels, which leads to infarcts. And we all know that infarcts just means it's not letting the oxygen through. That's what an infarction is. And we have impaired capillary perfusion, organ damage, ischemia, and acidosis. And this type of acidosis at this point is going to be metabolic. It's kidney involvement for sure. And if you didn't like my cartoons, this is just another way to look at it. The underlying disorder, what is it? Is it pregnancy-induced hypertension? Is it a boggy uterus? Is it retained placental fragments? Overstretched uterus due to large baby or multiple births? Whatever it is. But we've got a systemic activation of coagulation, consumption of platelets and clotting factors because of the bleeding. And it's all being consumed and the bleeding continues. Or we have enhanced fibrin formation. I shouldn't say or, and. It's at the same time. That's the problem. We've got the clotting factors being formed, and we've got the bleeding going on at the same time. But enhanced fibrin formation, we've got the fibrinolysis with the fibrin split products, which is forming our microvascular. All that means is in the tiny vessels, a lot of blood clots and organ failure. Okay, I'm going to stop right now and we will proceed with the next video soon.